Hi, this is Dr. Kaan of the ACL Academy, and today I'm going to touch on one of controversial topics out in the ACL rehab world, and that is the open chain knee extension exercise or leg extension exercise. So it is the only isolated quad strengthening exercise out there, but still people are fighting this exercise, saying that it causes too much stress on the knee, or it puts too much stress on the graft itself, or it ruins your meniscus. And I'm here to tell you that that is false. There is a lot of evidence out there that suggests that it is safe and super effective and the only isolated quad exercise out there. And when you're talking about ACL recovery, the quad muscle is king and takes the biggest hit after ACL surgery and injury. So it's important that we work it, and we work into isolation early and often. Before I get further into this video, please, if you have found value with these videos, subscribe to the channel. If you have questions or comments, please leave them below. We get to every single one. And more importantly, if you have a fellow ACLer that can benefit from these videos, please share our info with them. So I'm going to talk a little bit about the leg extension exercise, and I'm going to show you how we incorporate it early after ACL surgery, because we believe that it is a key in not only getting the quads going, but also smoothness in the recovery process. For those of you who don't know, quad weakness can linger for people like you who've had ACL surgery for a year or 2 years out. And unfortunately, if you never get your quad strength back, you develop a lot of compensations, and also you're more susceptible for re-injury. So it's important that, of course, along the way, you'll hear me talk about strength testing. It's important that you strength test throughout the process. We start at month 3, and then we strength test every month thereafter. And we want to keep track of that quad muscle to make sure that you're getting close to the other side. Also, getting both legs where they should be for your height and body weight. Super, super important, especially if you're an active person looking to get back to sports and activities. And I have a bunch of videos on strength testing, on quad work, quad activation early on. But today's video, I really want to focus on and show you guys, give you an inside look on how I get the quad going in this open chain exercise week 1. And we believe that it's important to do an exercise like this early, because we want to not only get the knee moving as it is in that joint, right? Flexion and extending, working it against gravity little by little and loading little by little in order to really wake up that muscle and get it going. So this video is going to solely just focus on my progression of the leg extension exercise early on. So this is the first week 1 till about week 4, week 8. So it'll give you a little inside look at how we incorporate this right after surgery. I have other videos where I talk about quad activation, how we use stim for the quads. This, though, however, will just give you an inside look at the knee extension machine in particular. So let's get to it. Really, in order to do an exercise like this, you want a higher chair where your feet are not touching the floor, right? Because that's how we're going to incorporate this. And you do need about 90 degrees of range. Just to let everybody know what 90 degrees of range is. If I'm sitting like an L, right, if you see my legs make an L, it's about 90 degrees. This is 0. So that's how we measure extension and flexion. So 90, 0. And just a little caveat for people, if you had other surgeries along with your ACL reconstruction, please ask your provider about this, or you can drop some questions or comments below. This is what I incorporate for my ACL reconstruction clients alone, without any other surgeries. So basically, when we're out of surgery, right, and this could be a few days out, it could be a week out, we're looking to get 90 degrees. Once we get 90 degrees of this motion, we can start these open chain type exercises. How I do this is in a few different ways, okay? First, what we like to do is incorporate an active assisted leg extension exercise. So let's say my left leg was the surgical leg, the affected leg. My right leg is the healthy leg. I'm going to use my right leg to assist my left leg through the motion. So basically, I take my right foot, scoop it under the left heel here, And I'm going to activate this quad. So I'm going to utilize my muscles to push up, but at the same time, I'm going to help with my right leg. So this way, I'm getting some work out of this quad, so it's activating, but at the same time, my right leg is assisting. So we're assisting the full motion here. We're just getting our knee used to active assisted motion, so from 90 degrees to about 0 degrees, and we're getting full motion with our quad muscle working. So I do like this exercise to incorporate both the assist, to let the knee know what its available range is, and also to wake up that quad muscle. So you are doing as much work as you can with the surgical leg as possible. So this is an exercise that we would do daily. You may do reps of 10, 20 even, or we may even do a time limit where you're just working for a minute up and down, working that quad. Now, more on the strengthening piece, what we start with is what we call isometrics. An isometric contraction is a contraction where you're contracting this muscle, but it's not necessarily moving or going anywhere, right? So we're not working through the range. So in order to do this, I first started at 90 degrees, and I'm going to work these isometrics at different angles, right? Most of you are used to doing quad sets where the leg is straight and you're kind of pushing down. This is also an isometric. So it's a quad set exercise at 0 degrees range of motion. Now, when we get into this position, we're going to show you how you can do it throughout the range here. So I'm going to take my right leg. First position will be at 90, right? My knee is making kind of a 90-degree angle. I'm going to take my right leg and put it right in front there. And what I'm going to ask my left leg to do is push into the right leg so that elicits a contraction here, but I'm not moving. Okay, so it's a 5 to 7 contraction there, holding, and then rest. Push in, you count 1, 2, 3, 4, 5, and rest. Okay, so we're going to do a few different contractions at this level. We might do 5, 6, or 7. Then what I'll ask to do is we want to work the isometrics at different angle ranges. So this will be 90. I'll take my right leg and I'll bring my other knee up to about 60 degrees. And what I'm going to do is move my right leg off of it. So this way I'm working it against gravity. As soon as I move my leg, I have to contract this muscle to fight gravity, and it's going to get a nice contraction there. Okay, 5 to 7 seconds, then you could put your foot back. And then again, 5 to 7 seconds, you're working that muscle against gravity and put your foot back. Okay, you'll do a few reps there. Then you may go up to about 30 degrees here. Same thing, 5 to 7 seconds. And then you're working isometric at that angle. And then you may even work it at 0, where I pull it all the way up. I'll see if I can take away my right foot, hold it, put it back on there. Take away my right foot, hold it, and put it back on there. Okay, so this is what we call isometrics at different angles of the range. And you can work it just against gravity like that. You can even challenge further once you get stronger, where you bring it up to, let's say, 6 degrees here. The other leg goes on top, and you kind of push and challenge that way. So you can do it. But once you're able to kind of work the isometrics throughout the range against gravity, we like to start working through the range, right? So now we'll just do regular active leg extension. And I may work partial ranges first, so 90 degrees to 45. Okay, so here I'm going up, holding maybe at the top for 2 to 3 seconds, and then resting back down. Nice and controlled up, 2 to 3 seconds, and then resting back down. As this gets easy, I will incorporate ankle weights or a TheraBand, where we're going to start doing some resistance. Early on, the first month to 2 months, we're going to focus more on doing more volume and less weight. Okay, it's just a little safer that way, where we may be doing reps of 15 and 20, right? 2 to 3 sets of 15 and 20, and we're working lower weight. We're just working more volume of the exercises. As you get past month 1, 6 weeks to 8 weeks, we're going to start loading more and bringing the reps down, because we want to work in strength building schemes. So instead of 15, 20 reps, I'll go to under 10 reps. So 8 reps, 6 reps, 5 reps even, right? And we'll start loading more and more. Once we're comfortable doing the partial range, 90 to 45, then we'll work as much as the full range as we can to about that 0 degree mark. Okay, some people will struggle getting 0 degrees on their own. That's okay. You just work the available range that you have. And again, you'll start with just against gravity. As this feels comfortable, then we're going to load up with ankle weights, right? So that they're going to work that higher rep ranges, right, for that first month, 6 weeks, and then we'll start lowering the rep ranges, increasing the weight little by little. Once we reach about 10 pounds with an ankle weight like this, we're ready for the leg extension machine. So we'll transition you over to a gym at that point. But it's important that you can do this exercise with the weight controlled and really working and isolating that muscle. We don't want you lifting the hip up and trying to kind of move the weight that way or cheat. You really should be sitting nice and flat. The thighs should never leave the table, and you're going to take as much range as you can this way. Okay, so that's how we give you like a little inside look on how we work that leg extension exercise early and often. Really for us, like first few days may be tough because you may not have the range to do so. So once you really need that 90 degrees of flexion, that bending range, and then you can start incorporating an exercise like this. So we like to do active assisted motion, where you're using the other leg to help you through the motion. Then we're working the isometrics at different angles, right? So that's at 90, then we'll do 60. You can do another one, 45 and 30, another one is 0. So you're contracting, right, without moving the muscle through the range. So you're strengthening at different parts of the range. Once you feel comfortable with that, we'll work partial range, so 90 to 45. Okay, and as that feels comfortable, you can begin to load that. And then really we can get right into 90 to 0, just against gravity first, and then loading for weight. In those first few weeks, we'll focus on a lot of reps, less weight, really get you used to the motion, get you comfortable, get the knee joint comfortable with it. As you get okay with that, comfortable with that, we're seeing a nice solid contraction. Then we'll start to load the weight and lower the reps. So really, at the 2-month mark, we really want you starting to move weight and doing more strength building schematics. So that's reps of 5, reps of 6, reps of 8 at most, right? And we're really starting to load the weight. Once you get up to 10 pounds or so on the ankle weight, you'll be ready for the leg extension machine. So really our goal is to get you in the gym. Really for everybody who's close, between 2 and 3 month marks. I would love to get you in the gym. And we usually do our first strength test, okay, where we're assessing the quad strength itself, where we're actually requiring you to lift the amount of weight that you can, and measuring that side to side at the 3-month mark, and then we do strength tests every month thereafter. Super, super important, guys. If you had ACL surgery, you need to work the quads in isolation. So this is a great way to get started with it early on. It's so important to incorporate, because if you don't wake up that quad muscle early, you deal with strength deficits for a long time, and it will be a little bit of a struggle. So as soon as after surgery, we work the quads, we get them going, and the sooner you do, the faster you do, the better and more smoother your recovery process will be. Hopefully that is helpful to you. If you have some questions or comments, drop them below. If you found some value in this video, please like it. Please subscribe to our channel, and more importantly, share with a friend, fellow ACLer that can benefit from these videos and advice. We drop a video every Monday, so check us out. Also, we're on Instagram at the ACL Academy. You'll find a lot of good tips and info there as well. This is Dr. Kaan signing off. I'll see you guys next week.